Hello, I'm Dr. Dennis McKenna. Today I'm joined by Kim Williams. Kim, welcome.
Thank you.
Good to have you here. Kim is the Vice President for our Center of Excellence, and we're going to talk a lot about what you do and your role here in just a couple of minutes.
Great.
All right, very good. Today's Thursday, February 17th, giving you the update from Albany Med. All right, Kim, we're going to do the COVID numbers. We'll pop open the first graph. We see cases in New York State. It's the same story as last week. The slope is going down and going down quickly. Currently in New York State, 3,265 cases in the hospital. Let's pop open the next graph here. Same story in the capital region. Again, coming down a number certainly lower than it was just 1 week ago. We have 187 cases in the capital region of individuals with COVID. One of the metrics, Kim, that we look at is the 7-day rolling average. And we've talked about that. Currently, the 7-day rolling average of new admissions is now under 2 for all 100,000 people.
Wow.
So what that means in the capital region, we sometimes estimate of having 1 million people. That means on average, there's only 20 people per day who are being admitted. And that number has come down significantly, obviously, over the last couple of months as well. Another number which people look at is the percent positive. So this would be individuals who are tested for any reason. What percentage of them test positive for COVID? And we look at the 7-day rolling average. For the first time in quite some time now, we're under 5%.
Amazing.
And it is amazing. And the reason why that's important is here on this campus, once we have a 14-day rolling average, under 5%, that will allow us, based on guidance given to us by epidemiology, to start reversing some of the things we did and that were quite frankly necessary at the highest level of the pandemic. And we'll talk more about what those changes will be once we get there. But we're watching those numbers very carefully. By the way, the percent positive 7-day rolling average for the state is 2.8%.
Amazing.
So everything moving in the right direction. All right, let's pop open the next graph here. We're looking at admissions and discharges here to the medical center. You can see over the last 7 days, we've discharged more people than we've admitted. In fact, our case count in the hospital has come down by 10. If you look at the 44 people who were admitted to the hospital in the last 7 days, it should be pointed out that 27 of those 44 were unvaccinated. So continue to see about 2/3 of those that come in are unvaccinated. And then lastly, the morning census here at the medical center today, we currently have 61 in the hospital who have been diagnosed with COVID. Of those, 57 are adults and 4 are pediatric. Interestingly, 20 of the 61 no longer infectious. So they're in the hospital not for COVID, they're in the hospital for other reasons. And of the 61, 8 are in the ICU. One more graph. Let's talk about variants. People want to know what's the variant out there. It continues to be Omicron, but what's interesting is if you look at the graph now vertically, if you look at those 2 colors, they're both Omicron, but one is one subtype and one is the other. So it's BA1 and BA2. But again, it's still 100% Omicron. All right, let's transition to some non-COVID topics, Kim. First of all, we just recently learned that our trauma program here has received some incredible recognitions. Statewide, there were 5 different awards given out for trauma awards statewide. And of the 5, 3 of them were given to folks here at Albany Med.
Absolutely incredible.
Yeah, for sure. So those individuals are Tom Moran, Jasmine Adderley, and Damian Russo. So we congratulate them. As you know, Kim, we have the only level 1 adult trauma program in the area. Our pediatric trauma program is currently designated level 2, but in point of fact, we'll be going for, and we certainly will get level 1 pediatric trauma program during the next accreditation process. We have the busiest trauma program in the state, and our clinical outcomes are great, and it's because of people like this.
Absolutely.
So congratulations to them. I don't know if you had a chance to see the most recent Inside Albany Med where I interviewed Amy Muller.
I did.
Yeah, it was fun. Amy, of course, was a nurse in the emergency department for many years. She currently works in the Access Center, and she plays a very pivotal role there. And in addition to that, each day she brings into work a couple furry companions, and she raises dogs for the visually impaired as well as individuals with autism. And it's really a special relationship she has, and that Albany Med allows her to do that. It's a great story. Amy works in the Access Center, and Access is one of the areas that you work on with Pillars 22.
It is. they do a tremendous job.
Yeah, for sure. There's going to be a community grand rounds coming up next week, and we encourage you to look on the intranet. We encourage you to register for that. I believe there's a link there for to do that. The topic is melanoma and people of color, a very important topic, and again, an offering from our community grand rounds that distinguishes us really from a lot of the hospitals in the region. All right, I've talked enough, Kim. Let's turn to you and the reason why you're here today. You and I have worked together for many years.
Yes.
But take us back and tell a little bit about your journey through Albany Med and the roles you had, and then we'll talk specifically about what you do today.
Sure. So I've been very fortunate to be with the organization for 16 years.
Right.
And I actually started in our corporate finance department as a senior budget analyst.
Okay.
And I worked my way through a couple roles in finance for several years there. And then I transitioned over to the hospital working in our quality management department. Had really a tremendous opportunity to learn more the clinical side and learning more about how the data was so important. And then at that time, we were also undertaking some very large CMS regulatory requirements that I actually played a pivotal role in particularly on meaningful use and all of that. From there, I transitioned actually, very fortunate, into the medical director's office at the time when you were the CMO.
Right.
And then worked my way through in really leading towards the current role I have now, which has only been the past 3 years.
And among the things we worked on together were things such as length of stay. You were obviously very much involved in that. We were involved in projects that really required a lot of project management, quality initiatives. I remember working with you on those projects and the great outcomes we had there. And you were recognized at the time as someone who could really manage projects in a very comprehensive way, keeping track of a lot of things, which is why you were such a natural to move up and to take on this important role for Vice President, Center of Excellence. So let's talk about some of the things that live within that universe.
Okay.
Pillars 22.
Yes.
Pillars 22 is the way in which we execute on our strategic plan with the tactical things that we do. And there are projects that are so important to us that we want to project manage them in what we call Pillars 22.
Yes.
Talk about your role there.
So what we do is we have programs such as Access that you mentioned earlier, and we help organize the teams to really have a very defined focus on what we're trying to enhance. So for Access in particular, it's really increasing access for our patients into our clinics and other really key areas. The transfer center that you spoke about is another area that we have a defined kind of focus on. Urgent cares, we're also exploring telehealth. That's just one of the many programs we have. The reason for Pillar success is, of course, the teams that we work on, which span across the organization, and they're multidisciplinary, which has really made all of the difference.
How many different Pillars teams are there?
As of right now, there's about 25.
25 teams, and so you and your team
Yes.
manage those projects. And the Pillars work now is system work as well, correct?
That's
you have
correct.
people from the other campuses that are involved in Pillars.
Yes, and I think it's important to note that Pillars kind of spans across the organization, so it's not clinical focused. It can be revenue cycle, supply chain, anything really.
One of the great reasons why Pillars has been so successful is the discipline that we have to be sure that there's an expectation that you'll be reporting out again in a month, and that there'll be an expectation to be held accountable for certain data sets. Understanding sometimes there may be setbacks, and that's okay. We'll learn from them and we'll move forward, but things don't get pushed off to the side. The fact that we were able to execute on so many of those initiatives, even in the middle of the pandemic, I think speaks to how well organized the Pillars work is.
Yeah, it's been great. Incredible people working on this work.
All right, let's talk a little bit about the leadership development
Yes.
and what's going on there.
So very exciting. It's really organizational development, which is a way for us to do leadership development training for all of our leaders. Right now, the first class that we've launched is really more focused around supervisor and managers, which, it's amazingly enough, encompasses more than 400 people across the organization.
And those individuals talk a little bit about the curriculum that they're going to get.
So actually 4 of the classes have already started. We broke up the groups into cohorts. There'll be cohorts of 9 and 4 have already launched. And it really encompasses things like technical skills, like project management, like how to have crucial conversations with your staff. But it also has some of the softer skills too, like conflict management, change management, which is a lot of what we'll be talking about later with the work that we're undertaking now. So it includes new managers and existing managers, and so far the initial feedback's been very positive.
Absolutely, it's been positive. I've had a chance to address at least one of the groups. I'm going to address all of them. I think one of the other topics is communication, correct? And our own Matt Markham is going to come and do a lecture on communication and how to be effective in that as well.
An effective presenter, because Matt is a natural at that.
Oh, he's the very best. He absolutely is. One of the things I said to that group is that it's important to remember that leadership is not a burden. Leadership is a privilege. And this is an investment we are making in the future of the system, really, by giving an opportunity to bring these individuals in and give them additional skills so they can help us in our mission. So congratulations to you on that. And then if that was not enough, the Center for Excellence is also going to be integral to the rollout of our electronic medical record as well as our ERP.
That's right. So what we're doing right now is really getting ready for the ERP launch, which will be happening in just a couple of weeks, and then organizing that work and getting ready, working with their consultants so that we can formulate the structure so that we'll be ready to implement soon as we have the kickoffs for those.
And if any of those things that we talked about is something that is of interest to individuals out there and they want to reach you, they can email you. And
absolutely.
Because we need as much help as we can on all these projects.
We sure do. A lot of work coming up.
All right. Well, good. Well, Kim, I think you do a fabulous job. I've always enjoyed working with you. I remember your days back when you were in quality. And I said, I need to have a little bit more of that energy in our office. I appreciate that, and you're doing great work now.
Thank you. I feel honored to have the role that I have.
Thank you. And let's close out by talking about our most recent Daisy Award winner. These, as we often talk about, are individuals that are recognized either by family members or patients for the care they delivered. And let's pop open the picture and let's congratulate Max Clayton, who is a registered nurse from the Neurosciences Unit, who was honored with a Daisy Award for outstanding patient care. Max was nominated by a patient who wrote, "Max made me feel I would be made whole again, and he made me feel safe. He's really a great caregiver." And when you think about the Neurosciences Unit and that idea of being whole, that I think it's very powerful. So Max, congratulations and well-deserved, and we're very proud of you. Thank you. So that'll do it.
All right.
All right, we're rolling into the weekend. Who did you want in the Super Bowl?
Not the one that won.
Okay. It was a great Super Bowl.
It was indeed.
So congratulations to the Rams. There's a young man who comes into the Melody Center that I owe some pizza to. So I'll make that happen. All right. For those that are working here this weekend, we thank you very much, now more than ever, for everything you're doing. And we look forward to seeing you next week. I won't be here next week, but I'm sure others will fill in the role. Maybe you could be over here.
Perhaps.
And we ask that you once again, please take care of yourself, take care of each other, and we'll see you soon next week.